Acute coronary syndromes, or ACS, represent a spectrum of conditions associated with sudden, reduced blood flow to the heart, including ST elevation myocardial infarction, non-ST elevation myocardial infarction, and unstable angina. ACS is a major emergency that requires immediate attention to prevent heart muscle damage or death. The timely recognition and treatment of these conditions are critical to improving outcomes and saving lives. The heart, a muscular organ, relies on a constant supply of oxygen-rich blood to function effectively. This blood supply is delivered through the coronary arteries. When these arteries are blocked or severely narrowed, the heart muscle, or myocardium, is starved of oxygen, leading to what is commonly known as a heart attack. The degree and duration of the blockage determine the severity of the damage. The phrase, "time is tissue," aptly underscores the urgency of treating ACS. Every minute of delay in treatment results in more heart tissue being deprived of oxygen. The longer the heart muscle goes without oxygen, the greater the damage, which can be irreversible. Immediate medical intervention can significantly reduce the extent of heart muscle damage and improve survival rates. Understanding ACS is crucial for recognizing symptoms early and seeking prompt medical attention. Early intervention can mean the difference between life and death. In the sections that follow, we will explore the different types of ACS, their symptoms, and the importance of timely treatment. The concept of time as tissue is central to the management of acute coronary syndromes. This phrase emphasizes that the quicker treatment is administered, the more heart muscle or tissue can be saved. The heart muscle begins to die within minutes of being deprived of blood flow. Thus, every second counts when it comes to treating ACS. When a coronary artery is blocked, the oxygen supply to a portion of the heart muscle is interrupted. This blockage is often caused by a blood clot that forms on a ruptured plaque of atherosclerosis. Without immediate intervention, the affected heart muscle will suffer permanent damage. This is why rapid diagnosis and treatment are crucial. Medical treatments such as thrombolytics, angioplasty, and stent placement are designed to restore blood flow to the heart as quickly as possible. These interventions are most effective when performed within the first few hours of symptom onset. Public awareness campaigns often highlight the importance of recognizing heart attack symptoms and acting fast. Symptoms such as chest pain, shortness of breath, nausea, and sweating should not be ignored. Calling emergency services immediately can ensure that treatment begins en route to the hospital, further reducing the time to intervention and potentially saving heart tissue. A myocardial infarction, commonly known as a heart attack, occurs when blood flow to a part of the heart is blocked for a long enough time that part of the heart muscle is damaged or dies. There are two main types of myocardial infarction: ST elevation myocardial infarction and non-ST elevation myocardial infarction. Both types are serious, but they differ in their severity and treatment approaches. STEMI is characterized by a complete blockage of a coronary artery. This type of heart attack causes significant damage to a large portion of the heart muscle. The electrocardiogram shows a distinct elevation in the ST segment, which is a crucial diagnostic feature. Immediate treatment often involves emergency angioplasty or thrombolytic therapy to restore blood flow. And STEMI, on the other hand, involves a partial blockage of a coronary artery. It does not show the same ST segment elevation on an ECG. Despite being less severe than STEMI, NSTEMI still requires urgent medical attention to prevent further heart damage. Treatment typically includes medications and possibly angioplasty. Unstable angina is another form of ACS. Unlike myocardial infarctions, unstable angina does not cause permanent damage to the heart muscle. However, it does indicate that a heart attack may occur soon. Symptoms can occur suddenly and unpredictably, even at rest, and they may not be relieved by rest or medication. Immediate medical evaluation is necessary to manage the condition and prevent progression to a heart attack. ST elevation myocardial infarction, or STEMI, is the most severe form of heart attack. It occurs when a coronary artery is completely blocked, cutting off blood supply to a large area of the heart. This blockage is usually caused by a blood clot that forms on a ruptured plaque within the artery. The resultant lack of oxygen causes the affected heart muscle to begin dying. The hallmark symptom of STEMI is severe chest pain, often described as a crushing or squeezing sensation. This pain may radiate to the shoulders, neck, jaw, or arms. Other symptoms can include shortness of breath, nausea, vomiting, lightheadedness, and sweating. Recognizing these symptoms quickly is crucial for prompt treatment. Treatment for STEMI focuses on rapidly restoring blood flow to the heart. Thrombolytic therapy involves administering clot-busting medications to dissolve the blockage. Percutaneous coronary intervention, commonly known as angioplasty, is a procedure where a balloon is used to open the blocked artery, and a stent is placed to keep it open. This procedure is often performed in a cardiac catheterization lab. Time is of the essence in treating STEMI. The sooner blood flow is restored, the less heart muscle will be damaged. Patients who receive prompt treatment within the first few hours of symptom onset have significantly better outcomes. This highlights the critical importance of recognizing symptoms early and seeking immediate medical attention. Section 5 and STEMI, distinguishing features and treatment approaches. Non-ST elevation myocardial infarction, or NSTEMI, is a type of heart attack that, while serious, is generally less severe than STEMI. In NSTEMI, the blockage of a coronary artery is partial rather than complete. This means that some blood flow to the heart muscle is maintained, resulting in less extensive damage compared to STEMI. However, NSTEMI still poses significant health risks and requires prompt medical intervention. Symptoms of NSTEMI can be similar to those of STEMI, including chest pain or discomfort, shortness of breath, nausea, and sweating. However, the chest pain in NSTEMI might be less intense or even absent in some cases. The key diagnostic tool for NSTEMI is an electrocardiogram, or ECG, which typically does not show the ST segment elevation seen in STEMI. Blood tests that detect cardiac enzymes also help confirm the diagnosis. Treatment for NSTEMI aims to relieve symptoms, prevent further heart damage, and reduce the risk of future cardiac events. Medications such as aspirin, antiplatelet agents, and anticoagulants are commonly used to prevent blood clot formation and improve blood flow. Beta blockers, statins, and ACE inhibitors may be prescribed to reduce the heart's workload and lower cholesterol levels. In some cases, patients with NSTEMI may require angioplasty or coronary artery bypass grafting, known as CABG, to improve blood flow to the heart. The choice of treatment depends on the patient's overall health, the extent of coronary artery disease, and the severity of the symptoms. Early medical evaluation and intervention are crucial in managing NSTEMI and minimizing heart damage. Section 6. Unstable angina symptoms and management. Unstable angina is a condition that falls under the umbrella of acute coronary syndromes, or ACS. Unlike heart attacks, known medically as myocardial infarctions, unstable angina does not result in permanent damage to the heart muscle. However, it is a serious condition that signals an increased risk of a heart attack and requires immediate medical attention. The primary symptom of unstable angina is chest pain or discomfort, which may occur suddenly and unpredictably. This pain is often more severe and prolonged than the chest pain experienced with stable angina. It can occur at rest or with minimal exertion, and may not be relieved by rest or nitroglycerin. Other symptoms can include shortness of breath, nausea, sweating, and a sense of impending doom. Management of unstable angina focuses on stabilizing the condition, relieving symptoms, and preventing progression to a heart attack. Initial treatment typically involves medications such as aspirin and other antiplatelet agents to prevent clot formation. Nitroglycerin may be used to relieve chest pain, while beta blockers and ACE inhibitors help reduce the heart's workload. In addition to medication, patients with unstable angina may undergo diagnostic testing such as ECG, blood tests, and coronary angiography to assess the extent of coronary artery disease. Depending on the results, procedures like angioplasty or coronary artery bypass grafting, known as KBG, may be recommended to improve blood flow to the heart. Prompt and effective management of unstable angina is essential to reduce the risk of a heart attack and improve patient outcomes. Section 7. Real-life patient stories. The importance of quick response. Real-life patient stories highlight the critical importance of quick response in the management of acute coronary syndromes. Meet John, a 58-year-old man who experienced sudden chest pain while gardening. Initially dismissing it as indigestion, John continued working. However, the pain persisted and intensified, prompting his wife to call emergency services. John was diagnosed with STEMI and rushed to the hospital, where he underwent emergency angioplasty. His quick response and timely medical intervention saved his life and minimized heart damage. Another story is that of Maria, a 65-year-old woman who woke up in the middle of the night with severe chest pain and shortness of breath. Recognizing the seriousness of her symptoms, Maria's daughter immediately called 911. Upon arrival at the hospital, Maria was diagnosed with NSTEMI. She received medications to stabilize her condition and later underwent angioplasty. Maria's daughter's quick thinking and rapid response were crucial in ensuring Maria received the necessary treatment promptly. Then there's David, a 72-year-old man who experienced chest pain while watching television. Unlike his previous episodes of stable angina, this pain was more intense and did not subside with rest. David's wife quickly recognized the signs of unstable angina and drove him to the nearest emergency room. The medical team was able to stabilize David and perform necessary interventions, preventing a potential heart attack. These stories underscore the importance of recognizing heart attack symptoms and acting quickly. Immediate medical attention can significantly improve outcomes and save lives. Public awareness and education about the signs of ACS and the importance of quick response are vital in ensuring timely treatment for all patients. Section 8. The role of immediate treatment in ACS. Immediate treatment plays a pivotal role in the management of acute coronary syndromes, or ACS. The primary goal of treatment is to restore blood flow to the heart muscle as quickly as possible to minimize damage. Early intervention not only improves survival rates, but also enhances the quality of life for patients by reducing the extent of heart muscle damage. For patients experiencing STEMI, immediate treatment often involves emergency angioplasty or thrombolytic therapy. Angioplasty, performed in a cardiac catheterization lab, involves using a balloon to open the blocked artery and placing a stent to keep it open. Thrombolytic therapy involves administering medication to dissolve the blood clot causing the blockage. Both treatments aim to restore blood flow quickly and effectively. In the case of NSTEMI and unstable angina, initial treatment typically includes medications to stabilize the condition and prevent further heart damage. These medications may include antiplatelet agents, anticoagulants, beta blockers, and nitrates. Depending on the patient's condition and the extent of coronary artery disease, angioplasty or coronary artery bypass grafting, known as KBG, may be necessary. Rapid diagnosis and treatment are essential in all forms of ACS. The sooner treatment is initiated, the better the chances of limiting heart muscle damage and improving outcomes. This underscores the importance of public awareness and education about the symptoms of ACS and the need for immediate medical attention. Section 9. Conclusion. Awareness and rapid response can save lives. In conclusion, acute coronary syndromes, or ACS, encompass a range of conditions, including STEMI, NSTEMI, and unstable angina, that require immediate medical attention. The concept of time is tissue emphasizes the critical importance of rapid treatment in minimizing heart muscle damage and improving patient outcomes. Recognizing the symptoms of ACS and seeking prompt medical help can make a significant difference in survival and recovery. Education and public awareness are key to ensuring that individuals can identify the signs of a heart attack and respond quickly. Symptoms such as chest pain, shortness of breath, nausea, and sweating should never be ignored. Calling emergency services immediately can facilitate early intervention and potentially save lives. Patient stories illustrate the life-saving impact of quick response and timely medical intervention. Whether it's calling 911 at the first sign of severe chest pain or recognizing the sudden onset of symptoms in a loved one, these actions can significantly improve outcomes for patients experiencing ACS. Ultimately, the management of ACS relies on a combination of prompt recognition, rapid medical response, and effective treatment. By raising awareness and educating the public about the importance of quick action, we can improve survival rates and reduce the burden of heart disease in our communities. We hope you enjoyed this video on ACS by AffordableACLS.com.